Approximately 70% of the world's malaria burden is concentrated in 11 countries, 10 on the African continent plus India. Africa accounts for 92% of the 429,000 people killed worldwide in 2015, according to the World Health Organization figures. Children under 5 represent more than 2/3 of these deaths. Sub-Saharan Africa also shows high concentrations of malaria infections and deaths, which presents continuous challenges in the health sector for mothers and their children in most cases. In Rwanda, 436,000 fewer malaria cases were recorded in 2017 than the previous year, according to WHO's World Malaria Report 2018, reducing severe malaria infection by 40%. Rwanda's vision in the next 7 years is to add about 150 health posts at cell levels, in addition to the existing 406, which are spread out in 2,148 cells until at least each cell has its own health post. SFH Rwanda, in partnership with AC Johnson, have committed to looking into the government of Rwanda's efforts of increasing health posts in the country.
One of the key milestones for these health posts is that it actually puts the services, the health services, so much at, I may say, at the doorstep of the people, because a person has to walk a maximum of 30 minutes. So this is really great. So in a partnership with AC Johnson, we have done 13, some in Nyanza, some in Nyagatare, some in Kirehe, some in Rwamagana, and we are also going to now work on 40 others.
Health posts are established in areas which are far from health centers, allowing easy access to health services. They have helped cut down distance and transport costs at least by half, which in turn also boosted quality services provided at health centers due to reduction of congestion of health service seekers.
Nkanjye nagendaga nk'ibirometero 4 kugira ngo ngere kwa muganga. Nkagerayo nkererewe kandi rimwe na rimwe narembye.
Ivura itaraza malaria yagiraga ingaruka nyinshi ku baturage. Rimwe na rimwe umuturage agahitamo kwivuza imiti ya Kinyarwanda, ariko hizi poste de santé zaziye ntago bikigoye nka mbere.
Local government authorities and health center personnel say health posts have helped distribute quality medical services to citizens among other benefits.
Poste de santé yaradufashije cyane mu kurwanya malaria, kuko n'ubundi hari gahunda za leta zisanzwe ziriho zo kurwanya malaria. Ariko ugasanga ubukangurambaga natwe buratugora nk'ubuyobozi, ariko iyo hagere dufatikanya n'abaganga baho tukajya mu baturage tugakora ubukangurambaga turi kumwe n'abaganga.
Ariko ku kigo nderabuzima cya Gahombo, poste de santé zitarubakwa, twakiraga abantu benshi, bigatuma n'abo bantu baje baturutse kure kandi barembye tubaha serivisi z'ubuzima bitinze. Ariko aho zubakiwe izo poste de santé, twakira abantu bakeya ku munsi, bakanabona serivisi z'ubuzima byihuse kuko baba bari bakeya, bigatuma bataremba.
What do health posts facilitate? Health posts have enormously contributed to malaria reduction in Rwanda, as citizens can easily access malaria repellent products. Besides mosquito nets, health posts have products like Baygon coils, off lotion applied on uncovered skin available and affordable. Besides those products being available at health posts, community health workers possess mosquito repellent products which decentralize their accessibility, and citizens learn of their use without having to move around from their homes.
Abajyanama b'ubuzima SFH yaradufashije mu kurwanya malaria, iduha umuti bacana n'uyu nguyu bisiga kugira ngo abaturage babonere hafi babashe kwirinda malaria.
Uyu muti wa Baygon ducana kimwe n'umuti twisiga wadufashije kurwanya umubu ukwirakwiza agakoko gatera malaria. Iyi miti rero tuyisanga kuri poste de santé mu bajyanama b'ubuzima, abaturage rero twayiboneye hafi.
Health posts have also a health service package offered that includes annual general checkup and screening, family planning services, HIV voluntary counseling and testing, primary curative consultation, management of communicable and non-communicable diseases, postnatal consultation, wound care, follow-up on malnutrition cases, among others. The government of Rwanda's contribution to malaria reduction has been significant in the past, through conventional methods of encouraging citizens to sleep under mosquito insecticide-treated beds, clearing bushes and stagnant water, spraying houses and more.
Murabizi ko mu myaka ishize twagize malaria nyinshi cyane guhera muri 2012, ariko imyaka 2 ishize ishami ry'umuryango w'abibumbye ryita ku buzima ryasohoye raporo ivuga ko u Rwanda na Ethiopia byabashije kugabanya malariya cyane n'impfu zijyanye na malariya. Twaba twarabashije kugabanyaho abantu barwaye malariya bagera ku 430. Akaba ari ikintu cyiza rero, ariko tugomba gukomeza gushyiramo imbaraga kugira ngo kidatakara cyangwa tunakomeze dutere intambwe irushijeho.
The target of the country remains to end malaria by at least 2030. However, it is an uphill task that requires collective efforts from cross-border countries and the Great Lakes region, which is why for the very first time, Cross-Border Malaria Control Initiative meeting of the East African and the neighboring Democratic Republic of Congo was hosted in Kigali, Rwanda, to evaluate the scale of malaria in the region and strategies that can be adopted to minimize malaria prevalence. But first, how concerning is malaria in the region?
Our region, the Sub-Saharan Africa, with DRC, Congo, and the EAC countries, contribute 92% of all the cases of malaria. So it is a huge problem that we need to address.
With an issue like malaria, children dies, under 5 dies every 2 minutes. So there's hundreds of millions of cases globally every year, and it doesn't have to be that way. It's totally preventable.
Le Congo à lui seul représente 10% des cas de paludisme en Afrique et dans le monde. Et nous pensons qu'avec les autres pays de l'Afrique de l'Est, on peut aller au-delà de 30-32%. C'est énorme. L'Ouganda, la Tanzanie et nous-mêmes, nous faisons à peu près 25%. Et quand on ajoute le Rwanda, le Burundi et d'autres pays, nous sommes aux alentours de 30 et quelques. Donc la charge de la malaria, du paludisme est énorme et nous devons faire quelque chose parce que nos communautés se côtoient au quotidien. Les frontières, il n'y a pas de barrières qui empêchent les moustiques de passer. Et les gens qui habitent les 9 pays à 10 pays doivent se fréquenter. Donc la malaria demeure une menace dans la communauté d'Afrique de l'Est et au Congo en particulier.
The participants of this technical forum deliberated on potential solutions which include harmonizing policies and strategies for malaria control, creating a framework and working with stakeholders to holistically fight malaria at regional level.
Ntabwo buri wese yakomeza gukora ukwe, ntabwo buri wese yakomeza gushyiraho ingamba ze yihariye, tudakoreye hamwe ntabwo byakunda. Niyo mpamvu imibare itagabanuka cyane iyo igihugu gikora cyonyine, tudakorana ngo dushyireho ingamba zitureba twese nk'abaturanyi, nicyo gituma bitihuta. Iyi nama rero iraza gutuma tugira igenamigambi rimwe nk'ibihugu, cyane cyane rireba uturere duhana imipaka, kandi tugashyiraho n'ikipe igomba kubishyira mu bikorwa mu buryo bwihuse, nta guhagarara kugira ngo turwanye iki cyorezo cya malaria.
One of them that is critical that has come up is surveillance, improved surveillance and rapid response, focusing on malaria in the cross-border area. The second one, which is critical, is sharing knowledge, data and information on malaria. Because once we share, we can learn and we can improve our programs and our interventions. The third area, of course, is vector control, looking at what is working in one area, what is working in the other. Most important of all these interventions is to be able to synchronize when we are doing these things.
With this first initiative, that's what we are trying to do. We are trying to find some synergies across all the interventions, across all the countries that are in our block, including DRC. So block by block, we'll get rid of malaria in the entire continent.
No one person can do it all, so you need a team. Number 2 is cross-border collaboration. I mean, you saw people from Burundi, from Uganda, from DRC, from Kenya, from Tanzania, from Zanzibar, regional bodies like Roll Back Malaria, SADC countries, ALM. I mean, it is such a kind of combined initiative is a big lesson for me that you are not alone in the fight.
This is the journey of no return, as regional countries have embarked on cross-border cooperation, and the hopes are high because the willingness is at the peak.
I see the Africa we want. I see the Africa free of malaria in the near future because of this.
Before, one country could fight to eliminate malaria alone, but missing this part of cross-border collaboration, this was really a missing piece that is now no longer a missing piece. But now together we are collaborating as partner state, sharing borders, but also sharing the same burden and sharing the same opportunities now for malaria elimination. I think the future is bright as we work together with all partner states and all partners within the countries now joining their effort as regional level, not as a country level.
Cette réunion est importante. Nous allons évaluer les outils, les stratégies que nous utilisons ensemble, la surveillance, échanger les données, échanger les stratégies, partager les expériences pour qu'ensemble, à l'horizon 2030, je l'espère, nous puissions éliminer la malaria.
This maiden regional meeting was jointly organized by the Rwandan Ministry of Health, SFH Rwanda, AC Johnson and other regional organizations, all to mobilize each country's best practices to reduce malaria not only at the national level but at the regional level as well.